This is an ongoing research project, so here we really presented our preliminary data on a cohort of 63 patients with hormone receptor positive HER2 negative metastatic breast cancer, treated in first or second line mostly with CDK4/6 inhibitors and endocrine treatment, who received a biopsy at progression and when treated with other treatment options, including endocrine treatment, monotherapy, endocrine therapy with target agents, monochemotherapy, chemotherapy with other targeted agents, ADCs, or other target agents like PARP inhibitors in case of BRCA mutant disease. So the idea was to retrospectively and prospectively collect data on this specific subpopulation and try to detect some genomic features in the biopsy obtained at progression from CDK4/6 inhibitors and endocrine therapy to detect some prognostic or predictive biomarker of response to the subsequent treatment lines. So what we did here was analyze preliminarily these small cohorts from the Hospital Clínic de Barcelona. We are still enrolling some other patients, and also there will be other centers that in Italy and in Spain that will collaborate with us and will send us more biopsies and patients' informations. But in this preliminary analysis, we checked the predictive and prognostic value of molecular intrinsic subtypes of breast cancer in the biopsies obtained at progression. And this is quite unique because the studies that have been published so far regarding the prognostic and predictive role of intrinsic subtypes in hormone receptor positive metastatic disease have always mixed primary tumor biopsies or surgeries or biopsies obtained at the diagnosis of the metastatic disease or at several time points. So this is the first study, as far as I know, where the biopsy have been purely collected at progression on CDK4/6 inhibitors. And we demonstrated preliminarily that these subtypes obtained at progression are prognostic and are predictive of response to different kinds of treatments. More specifically, we saw that non-luminal subtypes, HER2 enriched or base-unlike, responded better to chemo-based approaches than monochemotherapy or endocrine treatments. Differently, the luminal subtypes at progression on CDK4/6 inhibitors and endocrine therapy, really in this case there was no big difference with all the treatments that were administered to these patients. So maybe non-luminal subtypes at progression on CDK4/6 inhibitors might represent a subpopulation of tumors that might be treated with ADCs or chemotherapy-based approaches instead of continuing with other endocrine treatments, because in this case they seem to perform very poorly.